Great. Well, thank you, Emily. And thank you to the Downtown Seattle Association for hosting today's conversation, which is another installment in the DSA Virtual Access series. I'm Jared Axelrod, and I lead local public policy and external affairs in Seattle for Amazon. Amazon is proud to be a DSA member, a mid-ratepayer, and the sponsor of the DSA Virtual Access series. Staying connected and up to date with what is happening in our community is just as crucial during our work from home environment. And we're appreciative of DSA for hosting this series and bringing us together this morning. Now, it's been just over a year since we first felt the effects of the pandemic. And as we all know, Seattle was one of the first cities in the US to experience the impact of COVID-19. As a company with deep roots and a large presence in Seattle, we acted at the start of the pandemic to begin providing relief where we could. We created the Neighborhood Small Business Relief Fund, which helped to disperse more than $11 million in cash grants and free rent to more than 900 small businesses in the community. We also donated nearly 9,000 laptops to Seattle public school students who needed assistance and devices in transitioning to remote learning. Fortunately, it's beginning to feel like we're seeing the light at the end of this very long, dark tunnel. Vaccines are going into arms, and we want to thank the many federal, state, local, and community partners who are rushing to deliver vaccinations to the public and are doing so equitably to ensure that the hardest hit communities are not left behind. Now, for our part, Amazon has hosted Virginia Mason Franciscan Health to our campus, which has now held 17 vaccination clinics on site at our Seattle Meeting Center. And I'm happy to share with you this morning that we've delivered now more than 50,000 COVID-19 vaccine doses to date, and we will keep the doors open and continue immunizations for as long as necessary. Now, today's topic on a return to office is especially timely and is a topic that I know is on a lot of our minds. As you may have seen, we were pleased to share last month that our plan is to gradually return to an office-centric culture as our baseline. We believe it enables us to invent, collaborate, and learn together most effectively. As a global company, the timelines for returning to the office will vary by country, depending on the infection and vaccination rates, and we expect our return to the office to be gradual. But for our Seattle, Bellevue, and Redmond offices, we expect more people will start coming into the office through the summer, with most back in the office by early fall. Now, I should say Amazon offices remain open, and about 10% of our corporate population currently works from an office each day. Restaurants, cafes, and shops in our buildings are already open or are planning to reopen soon as well. As always, we maintain strong safety protocols, such as temperature screenings upon entry, physical distancing guidelines, face covering requirements, office occupancy limits, and enhanced cleaning in all offices. And I'd also like to say that the health and safety of our employees is and has been our top priority as we've thought about how and where people should work during the pandemic. Over the past year, teams have done incredible work under difficult circumstances, and we've learned a lot about the pros and cons of remote work. We look forward to the day in the not too distant future when we can all again invent together safely and in person on behalf of our customers. And with that, let's get into the discussion. I'll hand it over to today's moderator, Felix Bunnell, to kick off the conversation and introduce our panelists. Thank you.
Thanks, Jared. Thanks also to Amazon for their support for this series, and to John Scholes and his staff, Emily and James, and everyone at DSA for producing this virtual access series of conversations. And thank you everybody for joining in, and want to get to your questions, of course, later in the hour. Now, in the history work that I do, I often look back to challenging periods in Seattle history, and it can be so difficult to get below the surface, get beyond the black and white pictures and the newspaper clippings. And so it's really an honor for me to be part of the deep dive discussion that we have planned for this morning with our great group of panelists. This is really, this is the stuff that people will be talking about decades from now, about how Seattle bounced back. So joining us today are Kris Richey Curtis. She's Managing Director of Jones Lang LaSalle Brokerage, or JLL. Kris has been active in Seattle commercial real estate for 16 years. She specializes in brokerage and consulting services for all kinds of clients, including large downtown and regional tenants. She's also on the board of Mary's Place and Seattle Metro Chamber. Dr. Vin Gupta, he's a professor in health metric sciences at the Institute for Health Metrics and Evaluation at the University of Washington. He's a pulmonary and critical care physician. He's a health policy analyst for NBC News and a contributor to the New York Times and CNN. Dr. Gupta also serves as principal scientist at Amazon, providing clinical and strategic leadership to the company's internal and external COVID-19 response. Alex Hudson is Executive Director of Transportation Choices Coalition, the policy and advocacy group working to make transportation accessible to all. Alex leads our efforts to ensure that affordable, walkable, bike-friendly, vibrant communities are connected by transit. So for the next 30 minutes or so, we'll be talking about the next phase in downtown Seattle's COVID recovery, what the experts are seeing and thinking, what they're hearing from business people and elected officials, and how each of us can make decisions as the community moves forward. We do want to hear questions, and do, as Emily was saying, put stuff in the Q&A box. I'm monitoring that during the conversation. I'll often pluck things that people are asking about and work that into our conversation. So don't wait till the end. Don't hesitate to add your questions. And around 9:40 or so, we'll shift specifically to answering audience questions. Before we get started, I have just some basic data I want to share. In terms of vaccination, in King County, 56.3% of people older than 16 have received at least one dose of vaccine, and 35.2% are fully vaccinated. That's as of either yesterday or early this morning. We also have some information about downtown workers and foot traffic that's been compiled for DSA by Placer. Now, these are monthly figures that go through March. This is the latest data available. Visits by daytime workers, this is Monday through Friday, 8 a.m. to 6 p.m., are down as much as 86%. They're still down around 83% at the end of March. Visitor traffic, that's visits by those who don't live or work downtown, was down as much as 82%. It's now down only 50%. And overall foot traffic was down as much as 75% and is now down 52%. And looking at more recent trends, foot traffic has been picking up, in particular with regard to visitor traffic. By the end of March, daily average foot traffic among visitors was up 50% since the first week of the year. And if this trend were to continue, downtown Seattle visitor traffic would hit pre-COVID levels in June. And however, employee traffic continues to be fairly flat. All right. Now, one important note, we do want to hear from you for a DSA Regional Transportation Association Return to Work survey that's out in the field now, and we will provide that link to that survey to today's attendees. All right, with a thing like COVID, it's I think important to start with the medical aspects of it, the health aspects of it. And Dr. Gupta, what are you hearing from people? What are the questions that people are asking you most that apply to business owners, people who live and work in downtown Seattle about getting to the next step?
Absolutely. First of all, thank you for the invitation to be here. It's great to be talking about our pathway to normalcy. I'm hearing a lot, and so I'll try to categorize this and try to also be as concise as possible. But number one for businesses, not only in Seattle but across the country, is how can we start to normalize operations, indoor capacity limits? How can we liberalize those without putting too much strain on businesses, especially small businesses? And so discussions are being had right now about, well, should we have gating criteria? To what degree will there be a trend towards adoption of, say, vaccine passports, which is, of course, a controversial topic across the country right now? To what degree, if we do mandate that, or certain businesses do it, or industries like the travel, hotel, or restaurant industry mandate some sort of documentation for vaccination, if you do not do that, then must you present a negative test before entry? I've been advising the Mariners and the Seahawks and some similar organizations, and these are the conversations that are being had, because it is now plausible to create a vaccine or safe bubble, so to speak, for large events, whether it's T-Mobile Park or if you're trying to assemble a conference. And there is technology in place where you can actually do that. And so once we all have equitable access to the vaccine, so if you want the vaccine, hopefully you do want the vaccine, and you're able to get it, and you can show proof of it, then say come mid-July, which is what we're forecasting at the Institute for Health Metrics and Evaluation, come mid-July, we should be able to move towards that regime of documentation of either a negative test or vaccination to then really help businesses pragmatically reopen to full capacity. Because right now it's still really difficult with distancing requirements, even if it's 3 feet, it's really challenging. So that's number one. Number two, I'll just quickly say, I'm hearing, you're now seeing supply. This used to be a supply chain limitation issue. We were rationing vaccine access for the last several months, and now we're moving into a period of time where we're worried about demand side limitations. Are people going to want the vaccine? Are we going to be able to get to 75 to 80% coverage? That point at which we think hospitalizations from COVID are going to really nadir across the country, and we can safely reopen up across the country. It's demand side limitations. And I've been speaking to workforces across the country. Just spoke actually to the Mariners this weekend, and it's pretty amazing the similarity in questions that I'm getting from the 35 and younger crowd. They're worried about, well, do you need the vaccine if you've previously been infected? Does it cause sterility? Does it cause autoimmune disease? I mean, the same themes keep arising time after time. And so we have to directly address these head on. The same risk benefit calculation to the vaccine that apply to those 55, 60 and older does not apply to those 35 and younger. And we have to be really mindful of that and proactive in messaging. So those are the two issues that come up top of mind.
So that sounds like a different kind of vaccination hesitancy than I would have thought of when I think about traditional sort of anti-vax type of information or anti-vax movements, which I don't think are as prevalent in the Northwest as in other parts of the country. So that kind of education that you're talking about, is that the role of a county health department? Where is that messaging going to come from to address those kinds of things that you're hearing about from those, especially those 35 and under people, which are such a big part of the downtown workforce?
Well, I've had the chance to converse with Patty Hayes over at Salcombe County, and I know that they're thinking about those exact same issues. I do think this is, let's be frank, this is not something we've really had to deal with at scale ever before. How do you message to various demographics that we need everybody to really opt in when it's their turn for the vaccine? I do think we need to be mindful that different strategies are vital. So I've been practicing as a pulmonologist, not just here, but across the country. I just came back from Arizona where I saw younger people in intensive care units come down and end up on life support because of, not just because of pneumonia, but because of rare side effects from this virus. And so really leaning into storytelling, I found works to dispel myths about, well, younger people, they think they're invincible, turns out they're not. So that's number one. I think proactively addressing these concerns up front is going to be very important. Luckily, we have emerging evidence published yesterday, actually in the New England Journal of Medicine, that one of the key concerns younger people have is the impact of vaccines on pregnancy or on just fertility more broadly. And more emerging evidence is suggesting it's safe in pregnancy and that it's not going to impact your ability to have children if you're in sort of the thinking about family planning. So that's really going to be important as well. And then the more other the more people see folks in their own age cohort getting vaccinated and leading by example, I think that's going to help as well. So example setting is going to be really useful, but it's going to be a challenge here. So I think less citing broad statistics, more leaning into storytelling, visualizations on what COVID does to the lungs. These are strategies I've been using, but I think that that's where we're going to have to pivot towards.
And, short of an actual vaccine passport, are employers going to be able to tell their employees, we want you to return to the office, but you can't unless you've actually been fully vaccinated? Or is that something that goes beyond what an employee or employer has a right to do?
Right now, they cannot. The FDA has accorded emergency use authorization status to Pfizer and Moderna. Even though Johnson & Johnson is on a temporary pause, it also has an EUA from the FDA, which is only something that happens in a national emergency. You can begin to mandate vaccinations once there's full approval. So colleges and universities are expecting Moderna, for example, to get full approval imminently. And there is a movement for colleges across the country to say, come fall, you have to, just like you have to show meningococcal meningitis vaccination proof before you step on campus, you're gonna have to do the same thing with COVID-19, which I think is smart. And there's going to be, you're seeing in some cases, New York State, for example, or some organizations start to begin to prepare for a mandate. So it is something that will be a hotly debated item, I'm sure, for organizations across the country once there's full approval. Because here's the thing, if you feel like your organization has reached, say, 75% uptake of the vaccine on July 1, and you don't mandate the vaccine moving forward, and you have attrition or your workforce changes over time, you have no guarantee that you still have that coverage. And so it's nuanced. There's a lot of lenses to it, and I don't want to trivialize any of that, but it is going to be an important conversation to have depending on the organization and the nature of the risk.
Yeah, there's so many moving pieces to this, the government regulatory side, but then just what business owners are facing and trying to make decisions about space planning and staffing and upgrades they might need for their business, their spaces where they employees work or where their customers come. Kris, what are you hearing from your clients in the downtown Seattle area?
Well, it's shifted a little bit over the last year. Initially, we were in kind of that panic mode of how do we make the workplace safe with the distancing and all of the cleaning protocols and making sure people can get to work safely and then up an elevator safely. And I think the conversation shifted more to what does the post-pandemic planning look like, where you don't have to necessarily have those same protocols. And that's really, the big conversation is how do we pull the employees back to the office? I think people have gotten comfortable working from home. They like the flexibility and choice. There are concerns about returning to the office, whether those are perceived or real risks. And so employers are just trying to figure out how do we bring people back and motivate them to come into the office. I think that's the big question right now, that the vaccine's almost kind of fully distributed. Now we really do need to kind of set a date and make a plan. And I think that's the challenge today.
And I mean, in terms of setting a date and making a plan, what are the elements of that are critical from your perspective?
Yeah, I mean, I think there's a couple different things, and it depends on the industry. There are industries like the finance industry that said we have to do our work in person. The comments that Amazon made recently about we are a in-person workforce, we're going to return, in a phase and come back, full force in the fall. I think those are really strong messages that all companies need to hear and all employees need to hear. But there's such a fierce competition for talent right now. I think tech companies, especially smaller tech companies that can work or have been working virtually, are having a hard time wanting to bring employees back because they're worried that they're going to leave to some other firm that said, hey, you can work remotely forever. You can live in Montana and be at home. So there's this, I think there's a big sensitivity to talent and attrition around this. So there are the companies that are making arrangements to come back, begin the phasing this summer. There's others that are looking at kind of post Labor Day, and then there's others that I think are just kind of waiting to see, and they're a little bit timid on putting a stake in the ground because they're worried about what their employees are going to think.
Yeah, and the messaging part of it, I think, is so critical. I mean, I think it was chaotic around the public health aspects of it a year ago on a federal level. And now it seems like, just yesterday, for instance, the Seafair Festival, the long-standing tradition in Seattle going back to 1950, decided to have a virtual festival again this year after doing the same thing last year. And planning a big event like that obviously takes months, and they just made the decision based on looking at what their requirements were to pull off a successful festival, and they decided it's going to be virtual. And the bulk of that event happens in July and August. So how do you find that cohesion around declaring the? I always look back at World War II. World War II ended with VJ Day in mid-August 1945. Huge gathering in downtown Seattle, probably the biggest party in the city's history before or since. Completely impromptu, no planning, of course. And it was clear that the war was over because the Japanese had surrendered. There's not going to be a surrender or any kind of a VJ Day equivalent for COVID. But how do we create the sense of that VJ Day feeling of this is truly over? We can really get back to business, and the sooner we get back to business, it's better for all of us. How do we do that?
Well, it seems like we are starting to plan for some of these things. There are some dates and milestones that have been announced either through the government or through local. I think Dr. Gupta mentioned that we're hoping for 75 to 80% coverage here in the summer. Biden said the same thing. So if we use that as a milestone and a celebration point, and we say, everybody is returning, we've got companies that are making plans, saying publicly that they're going to come back to the office in July. There's a huge economic impact to that too. If we bring people back to the office, we have a chance to save a lot of the small businesses that have struggled over the last year because downtown isn't at full capacity. The places that you like to, eat at and dine during the day and all the places that you like to visit. If we could bring people back, we have the chance to save those businesses. So I think there's some plans in the works, but having some regional messaging and having the large employers band together so that there isn't this, well, I'm going to let them return to the office first so that I can take their talent, but just everybody, kind of makes the same proclamation about the return to office. And We, explain to the employees that there's a huge positive impact, and we create some celebration around this. I know there's concern about transit and there's concern about childcare, but in the summer, we're not relying on schools for childcare. So the summer vacation was already, in people's mind anyway. So I think this whole sort of summer milestone as well as the fall milestone is a good kind of two-part phasing.
Yeah, and let's ask Alex about the transportation element of this, because people aren't going to just all of a sudden overnight start returning to downtown Seattle the way they were pre-pandemic. What's ahead in terms of public transit for supporting the return to downtown?
Yeah, public transit is an extremely essential part of getting us back to a normal downtown, and that's just based on some simple math. There are about 250,000 jobs in downtown Seattle, and there are 35,000 parking spots. So that doesn't work unless we figure out a way to make sure that people are getting back on transit. So I'll talk a little bit about what the status of transit is, and then how the agencies across the region are planning for a return. So the first thing that happened when COVID struck was we saw some significant ridership declines. I want to highlight that was very different across modes. So we see different kinds of ridership declines on Sound Transit than we do on King County Metro, for instance. And there are some kinds of travel modes that we've seen exponential increase. You can check the Seattle Times, lots of breathless articles about how there's a bike boom and you can't get a bike anywhere. So some modes are actually up. And that's different across routes. So there are some routes like the 212 that takes you from Eastgate to downtown Seattle that has about a 77% ridership dip. But then there's routes like the 105 or the F line that only have a 7% ridership dip. So they look very different across the routes based on the communities that are being served. And right now the system, King County Metro, is providing 140,000 trips every single day, weekday trips in March of April 21. That's down from about 440. But what it does remind us is that 30% of the people who were on the buses before COVID are still there. And that includes a lot of people in Seattle who live car free, like my partner. He's a daily transit rider in our family. The agencies took pretty significant response, of course, starting with daily disinfections, requiring masks. They're tracking and communicating all of this. I'll share some links about rider dashboards. We know that communication and transparency, other panelists have talked about this, really critical, and the agencies have really stepped up to do that. So we know that well over 90% of people are wearing their masks on transit. These agencies have upgraded their filters in their HVAC systems. They've put in distancing that had been 6 feet. It was recently, because of the phasing guidelines, put back to 3 feet. So you can get 20 people on a 40-foot bus or 30 people on a 60-foot bus now. And they've increased transit service to make sure that as they had those load capacity limits, that they weren't passing people by. So they're making sure that everybody who needs a seat on a bus can find one. And then, of course, it's safety partitions between the drivers and the riders to limit any kind of transmission that might have there, and have really encouraged folks to go cashless. The people on this call are a big part of making that happen, putting those ORCA cards directly into the hands of your employees is how 60% of people ride transit are with those ORCA cards. So it's that cashless system that really encourages people to use transit. That's a really important part of all of this. And it's working. There is overwhelming evidence that shows that public transit is not been shown to be a transmitter of COVID, that on the employee or the rider side, there is no data that shows that public transit increases anyone's risk of getting the COVID-19 virus. On the service side, there had been a service reduction, but the agencies are beginning to return service. So 40,000 hours were added back to the King County Metro system last month in March of 2021. And they're being flexible and adaptable in order to be increasing that service as they are highly monitoring the return to ridership. They want to make sure that as your folks are trying to get back on those buses are ready to for that. And in fact, that is really the overall sense of all of the transit agencies in Washington are really operating under this sort of ready when you are sort of messaging and mentality. The agencies are ready, and when the riders are ready, they can come back on. We're planning for traffic return, so we're hoping to find ways to keep those buses reliable, watching national trends, and of course, coordinating with all of you to be timing and sequencing so that your employees have a good experience that first time that they get back on the bus.
Yeah, and I'm sure West Seattle fits into everyone's plans or hopes or fears about the future of a post-pandemic Seattle without that bridge available for single occupant vehicles and other things. There's additional service that's going to be offered or some way to kind of compensate for that large span being closed? Or
yeah, one of the really good things that's happened in transit this year is the overwhelming support for transit that we saw with the Seattle voters. In November of last year, voters in Seattle were asked to renew the Seattle Transportation Benefit District, and they did so by 81%. This is a national record for support for transit. So when I hear people say, you know, I'm ready to get back on transit, but I'm not sure about other people, I can tell you that the voters have a mandate that they're expecting for the transit to be good. And part of that was an additional investment in the C line service, which remains, you know, just like it was before, the fastest way to get from West Seattle to downtown, as well as water taxi service, which is back at similar level.
And just sort of a transit related question probably for Kris and for Dr. Gupta as well. What about elevators in high-rise buildings? Are there planning for that sort of thing? What's the thinking about that nowadays?
I was just actually thinking about that as Alex was speaking. It seems like a lot of this boils down to communication and the storytelling that we were referring to earlier. But I think employees need to understand kind of what is the day in the life of a work day back at the office look like. The commute on transit, it's safe. You listen to the stats that you're describing, and it's been done well. It's been done safely. People are willing to get on an airplane. Why couldn't you get on a bus? It's just this perception that like it's not safe to go to work, and maybe there's a little bit behind the thinking that's like, I just don't want to go back to work because I'm used to my new work from home habit. But then you get into the elevators. Right now, most of the elevators downtown have a limit of 3 to 4 people. But you're all wearing masks. And if we get to this 75 to 80% of people being vaccinated, or they have the antibodies, or you're wearing, you have some sort of vaccine passport, it gets even safer, and you probably don't even need to have those capacities. And then you make it up to your office space. And if you're distanced or masked, or that people have the vaccine, I mean, it's a completely different safety profile. And I think the government and all the different entities haven't done a really good job of informing the public. There's been a lot of misinformation and fear. And I think now we just have to be really clear about how safe it is to come back. But I'm not the doctor, so I'm sure Dr. Gupta has better information.
No, thanks, Kris. I'm trying to I noticed some interesting questions about to follow up on what Alex mentioned about the data on transmission in buses. And so I'm going to put the link to a JAMA article in the chat shortly. Just trying to find that link here in real time. Benefit of virtual panels here is that you can do this, you can multitask. So in just hearing some of the questions here, and Felix, I don't know if you want me to respond to some of them. There are Bree asks 6 versus 3 feet. I had a few other comments as well, but I'll try to be concise. CDC has basically updated guidance for in-person education. I'm sure many on the call here have seen that 3 feet is essentially no different than 6 feet, because we think that the mucus balls that we're all spitting out, if we are somebody that's a carrier of the virus, that they tend to the vast majority of them fall to the ground within 3 feet radius of the infected individual. So that's why 3 feet is now the new norm. I recognize that there's some confusion that is not being broadly applied, but it should. And so I agree with public transit that 3 feet needs to be the norm, especially in a regime where most of us are going to be vaccinated come mid-July, and we're still going to have guidance, at least temporarily, to mask. So 3 feet, in addition to all those other mitigation efforts, in addition to vaccination, is more than reasonable. And you could probably push back on me and say, well, hey, doc, why not just move towards no distancing and masking plus vaccination? And some places are doing that. You're noticing Dodger Stadium, for example, move towards a model where if you're vaccinated and you can prove that you're vaccinated through a third-party app, you can actually go into a certain section and as long as you're masking, no distancing is required. So I do think distancing limitations are going to become outdated into mid-July into August. And you're probably going to see a bit of a lag here from CDC and federal guidance, but I do expect that that's going to be one of the things that they do update for organizations to plan around. So that's number one. I'm going to put in a link to a study out of China back in the fall that showed that as long as you're masking in a public transit bus, there's minimal transmission, or essentially no transmission. Let me be very clear here: no transmission of the virus. Versus the counterfactual, where say some individuals are masking, some are not. You don't know their vaccination status. That's a recipe potentially for spread. So as long as we have compliance with mitigation efforts like masking specifically post-vaccination for a period of time, public transit and riding public transit systems is felt to be safe. Can I quickly share my screen here, Felix, if that's okay? I just wanted to show.
I'm not sure if that's a question for Emily. Can she do that? I'm not sure if you're allowed to do that.
Yes, you can.
I don't know if we have the access to do that or not. Okay,
I can do that.
Great.
Okay,
Yeah,
I'll quickly do this. I'm just going to try to. I'm a visual learner. For all those on the panel here, in terms of what to expect, just in conversations with local and state health officials, both here and in select states across the country, they're looking at this data from the University of Washington and other similar modeling outfits, but that by the end of June of 2021, we're expecting deaths and hospitalizations from this virus to really nadir to almost an all-time low. And that for all of you out there, when you're looking for metrics to guide messaging to your employees and your workforces, this is the key piece here. You'll notice on every major media channel, well, there's 60 to 80,000 new cases that per day, and that very well may be the case for the foreseeable future. But behaviors on testing will change, and less of us will be actually wanting to get tested post-vaccination. And this is going to be the key metric here. What is the hospitalization rate and the stress on the hospital system? As that normalizes, here in King County, 80 to 85% of ICU beds are still available. That's quite a cushion as we continue to open up, and that's going to be the key metric to ensure that we're safe as we open up. So just want to emphasize that. And then lastly, I'll just share, I'm sure everybody on the call here that's messaging to your respective workforces is already doing this, but just given my experiences talking to T-Mobile, or we had referenced my role at Amazon, other organizations as well. I do think proactive messaging to your workforces with a regular cadence, directly doing Q&As in a fireside chat format to directly address some of these questions head on has seemed to be really helpful. So just a strategy there, but happy to talk more.
Yeah, and we're also seeing a lot of our clients survey their employees. We've never focused so much on what an employee's life looks like. Are you dealing with childcare at home? How do you commute into the office? The demographics behind your workforce, and it's completely varied, and you have to. I think employers are really working to try to come up with how do we meet the needs of all the different subsets and provide flexibility and choice and sort of a customized solution for everybody, because they do need to. The post-pandemic workplace is going to look different than it did before. I don't think it's quite as extreme as people were saying 6 or 9 months ago, but we do have to adapt and innovate. And the sort of office of the future that we've been talking about for 5 years, I think, is accelerated, and it's going to happen a lot quicker. And so there's a lot to celebrate and to communicate to the employees. Like when you come back to the office, it's going to function better, and you're going to be able to collaborate better and connect with the culture and the brand and your people. We've all been kind of sitting alone at home, and there's so much that's been lost. We've been able to figure it out, and we've gotten by for a year, but a lot has been lost. And so I think we need to have this positive messaging about how it's going to be better than ever when you come back to the office, and kind of take all the lessons learned and try to make for a better employee experience.
And Kris, that office of the future, which has been, that has been accelerated, that notion of a more flexible workplace, or a place that can be more virtual at times. The hybrid model, which some colleges have been trying for a lot of the last year, that seems like what some employers are going to do, whether it means a few days working in the office, a few days at home, something like that. Are your clients making sort of decisions that cost, actual funds to make changes to their workplaces or to try to adapt their workplaces to fit, or their retail environments to fit those kinds of that future workplace?
Absolutely. There's a lot of investment and research being done right now, trying to figure out, what changes do you make, whether it's the layout or a lot of conversations around technology. If you are going to provide flexibility in some sort of hybrid work model for a certain percentage of your workforce, and you say, everybody can work from home 1 to 2 or 3 days a week, then you need to have some sort of technology so that employees can figure out, well, when is the rest of my team going to be in the office? And if I'm not going to have a dedicated desk, I'm going to have to reserve like a hotel workstation or a collaboration space. And so the amount of logistics that need to be coordinated around that are pretty significant. There's a lot of change management around that, but kind of at the heart of that is technology. And I'm personally a little bit pessimistic that we can all just work from home 1 to 3 days a week. And then when we come into the office, the people that we need to collaborate with will be there at the exact same time. There's also kind of the flip side of that if you give everybody, a couple half days a week to work from home, it's naturally going to be Monday morning and Friday afternoon that they want to be out of the office. Well, now you haven't been able to shed any of your office space because people are all there at the same time. And there's no, you're still using transit at the peak times in the same way. So, there's just a lot to have to assimilate, but companies are definitely trying to figure out, can we shed a little bit of space? Or if you take away some of the dedicated workstations, but you increase the collaboration space, maybe you end up with the same footprint. So it kind of just depends on the particular company or the industry sector, because they all kind of have different approaches.
And any shifts in trends for occupying offices or non-retail space has a huge impact on the retailers around those office buildings in terms of number of potential people buying whatever it is they're offering in that retail space. I mean, what are retail people thinking right now in terms of how they plan for this possibly new, very hybrid type environment?
More home delivery? No. Yeah, I mean, I would just hope that we come back at, a similar capacity to before, and that we don't lose all these small retailers. That's why we need to get, people back downtown. But, I'm not as close to the retail sector as I am in the office. I'm sure they're going to reinvent themselves. I mean, it's exciting to see all the outdoor dining that's occurred, and maybe that will carry on and they'll have, greater capacity than they did previously. And that will support, their business in a different way than had been done previously.
Mm-hmm.
Yeah.
The thing I would like to say, I'll just jump in really quickly about that too, is a reminder that people use transit for a variety of different reasons, not just to get to their jobs and back. And so this idea that Kris was talking about avoiding kind of peaks, accelerated peaks, right? Like everybody's getting in on Friday, no one's in on Friday afternoons and Mondays. And what may be able to happen, a way that our transit agencies can build back better is a system that had been very much about peaks, 6 to 9, 3 to 5, can become an all-day system. And that all-day system will actually ultimately better serve everyone. So as the future of work may look like more flexible start times or things like that, the agencies will respond in such a way that creates a network that functions not just for people's commute to work, but a transit system that gets them to their friends, that gets them to the parks, that gets them to their doctor's appointments, and all the things that we were using our service before, in fact, even more effectively than it did previously.
And let's go to one of the audience questions. This is from Roger. It says, as a way of incentivizing all communities to come back to Seattle, is anyone talking or thinking about offering citywide free parking, all buildings and streets for an interim period of time? Creating a messaging campaign sharing safe to work, straight up to the office would go a long way. Who wants to take that? Alex?
Yeah, there is, the Department of Transportation did remove parking enforcement for several months, but has returned to the collection of parking charges in all neighborhoods. It's really, really quite cheap right now, but it is, I have not heard of anyone who is planning to do a free parking citywide pilot project.
Okay. Another question. This is for Dr. Gupta. Won't COVID continue to change and morph into different strains, requiring the vaccine to be updated with annual boosters? If the flu shot is not a required verification for employers, how or why would employers require verification of vaccine for COVID?
It's an excellent question, and a two-part question. I think tackling the second first. Fundamentally, COVID-19 and its variants are just more lethal and have been exacted a global pandemic in a way flu usually has not, at least since 1918. So there is a sense here that a mandate would potentially is something to at least consider, given the gravity of COVID and the risk it poses just to our normal way of life, in a way that flu just doesn't. And just in case, I've gotten this question a lot recently, the difference between flu and COVID, and why does flu not necessarily cause an epidemic or a pandemic? Usually with flu, if you're infected with flu, you know it. You're in bed, you're symptomatic, and you're just like, I'm not going to work. Whereas with COVID, at least half of cases that are transmitting COVID are asymptomatic, so you don't know it. And that's why it's been so darn hard to control this virus. So with flu, it's so much easier to control year over year, and which is why, while it's important to get your flu shot, there's been less of this discussion on mandating it. About morphing and variants, I will say that this is the big concern here. Across the world is in chaos while we are marching towards that graph I just showed you, some version of normalcy. And so this should impact how you think about where you travel, since we all want to plan a vacation. And our new normal is not going to be crossing an ocean for the next at least few months, in my view. And the double, all these variants, whether arising from India, I just was on a call with our India ops. I mean, there are a lot of challenges out there. And yes, the big concern here is, will a variant arise that will escape the immune response from a vaccine? Right now, we don't think any of the variants that exist at this moment will do that. Which is why, if you heard the Pfizer CEO come out a few days ago saying, well, we're definitely going to need a booster in a year. Actually, I understand why he said that, and I think he had the best intentions to say that. But saying it right now when hesitancy is very rude in some communities, I thought was unhelpful, because it made it seem that in the absence of data, right now we know at 6 months the vaccine is very effective still in those who received the vaccine 6 months ago. Antibody levels are really high. We know the vaccines themselves are really protective against all existing variants. So then the question naturally is, then why is he saying we definitely will need a booster in 6 to 12 months? It made the anti-vaxxers or those who are hesitant wonder about motivation. So I don't know for sure if we're going to need a booster yet, but I think we should be planning for it. And that's what Dave Kessler and others in the Biden administration are really doing.
All right, and there's this question's a little bit related to that notion of creating a positive incentive for returning to downtown, returning to work, getting away from work from home. This is about, in terms of health metrics, is there data to suggest that the work from home period had a detrimental impact on mental health due to lack of social contact, depression, et cetera? And I would just slightly turn that question around to say, like, what are the benefits for someone who may be suffering mental health issues? What are the benefits of returning to work that downtown can offer all of us if we get back to the office and back to kind of working the way we did before a year ago? That's for you, Dr. Gupta. Yeah.
Yep.
Yeah. Let's start with the mental health aspects, the positive parts of that question.
Absolutely. Well, so the data I've seen, I think a lot of this is frankly underdiagnosed. I don't think we understand the true toll that the epidemic has taken on mental health, and a lot, social anxiety, and a lot of these sort of mental health spectrum diagnoses have just not been diagnosed. I will say anecdotally, though, conversations I've had, this does feel like this is a major problem. And what has been published suggests that there is a huge spike in the spectrum of conditions, and that there is not nearly enough in the way of services, whether telehealth related mental health services or in person, to contend with this. So so yeah, the answer to that is yes, absolutely. There's been a spike in social anxiety related issues, major depression, you name it. And I think it's part and parcel of the fact that we're also seeing a parallel rise in obesity and just inactivity. And so getting people back into the office, I know for a fact, but I exceed 10,000 steps when I'm downtown versus when I'm at home. And so there is a strong link between this spike in mental health related conditions that I still think the burden is underdiagnosed with cardiovascular conditions. And so returning to the office will have a 1-2 punch of addressing both.
4 out of 5 doctors recommend returning to downtown. This is a great question. This is about professional service firms. As we consider getting back to the office, we're also discussing not only our employees, but also guests and clients. As a professional service office, we look forward to face-to-face meetings with our clients and consultants. I'd like to hear the panel's thoughts about this topic. Kris, do you have thoughts about that?
Yeah, I mean, most of our clients, at least for the last year, have not allowed visitors to come into their space just to kind of contain protocols and ensure that everybody's moving around the office safely. But I think with everything that we've talked about, higher vaccine rates and safety protocols, I think we will see more visitors and guests come into the office. And I have not heard that as a stated concern that employees have. So I think it's a good thing, and we should plan to do that as soon as it's safe. And obviously there are county or state, mandated capacity levels for the office. So you have to make sure that you're not crossing over that threshold. But I would expect to see that in the coming months and be welcomed. So it helps us kind of return to normalcy.
Yeah, it's part of the whole equation. And there's a little bit of a chicken and egg to all of this. I think as a few questioners have pointed out, this notion of, if the people come before the buses and the buses aren't there, then, it sets us back. Or if the buses are operating, I mean, there's a lot of pieces that are in motion around all of this, and it's health related, it's economic related, it's real estate, it's all mixed together. That's why it's great to have you guys talking about this today. There's a question about, this is also related to this notion of communications. And, the past year around communications around the pandemic, I loved last week when Dr. Fauci got together with Beast Mode. That was great. That really got a lot of attention. You got people talking about things in ways that they hadn't, to a level they weren't really discussing things before. It just sort of pierces through all the phase 3, phase 2, vaccine level C1A and everything. There's a real opportunity for some real simple messaging around this, as Kris, as you've pointed out, and as is for a very complex issue where the notion is just get people back downtown, get them excited again. This is a question about, in order to restore the velocity of money in downtown Seattle, can we develop a shop downtown plan where employers provide gift or discount cards to their employees for downtown businesses to encourage them to patronize downtown businesses? Seems like a good idea. Let's talk about this whole messaging notion, because I think it's really clear that the sooner people are downtown and feel safe doing that, the better it is for everybody. Seattle's always been able to bounce back and this amazing amount of resiliency after national tragedies, after local setbacks. And this, every city is trying to do this, and I think Seattle is uniquely positioned to be able to bounce back like faster than any other place in the country. So if we were to develop some kind of messaging around the positive aspects of why people should return, what would some of the elements of that positive messaging include? Let's Kris, I'd ask you that first.
Well, from the kind of employer perspective, I think explaining what all the benefits are and kind of the things that we've lost during COVID. So being able to come back and meet in person and collaborate and connect with your culture and your brand. I know so many people that have been hired during COVID and they have never met their coworkers in person. So I think just explaining all the benefits of the socialization and using your office as a social hub, and then also communicating all the positive economic impacts that if we return to downtown and return to the office, we can save small businesses and we can kind of revitalize Seattle. We've been kind of in this holding pattern for the last year, and it's time to move forward. There's a lot to celebrate. I feel like there should be some sort of July, parties in the streets, and we're all coming back, and we need all the employers to sort of commit to dates so that people feel like okay, this is the time. And if I don't do it now, I'm kind of left behind. There's some sort of FOMO that's being created. So I think it just needs to happen on a regional basis, and kind of everybody does it at the same time, and the employees are excited. I think the forcing them back is where, you know, a lot of employees are digging in and they have all these stated concerns and fears, or they're just comfortable at home. I think we need to just create a lot of positive sort of celebratory messaging that, you know, it's summer in Seattle, we're returning to the office, the kids are out of school. Now is the time. This is an exciting kind of historical moment. That's what I would recommend.
Dr. Gupta, yeah.
No, and just to layer on what Kris is saying here, this is just my opinion. I know I represent a few different organizations here, but my own personal opinion here is organizations and businesses that adopt some verification system around vaccinations will be rewarded. And I say this because no one's really taken the deep dive there yet. Some have, but what people are craving more than anything, and just talking to varied groups across sectors, is certainty and peace of mind. After 14 months of like, well, does this test work? Does that test work? What about double masks? It is a mess in terms of the ways in which we've tried to give people tools to make themselves feel comfortable in the public domain. And knowing that you're entering a restaurant that feels normal and is safe because everybody in there is vaccinated, or, you know, and which I think is going to be a smart strategy, and will be very much adopted in a lot of sectors. I'm hearing it, is really going to be the incentive people need. They want to feel like they can have normalcy again in a restaurant. And so that type of approach there, I think it's as simple as that to some degree, is just how do you make people feel safe, because they are actually craving normalcy. They do want to go back to downtown, whether it's for work or for dinner.
Yeah, and I mean, that messaging is appropriate for Seattle. It's appropriate for Boston. It's appropriate for Miami. But I don't see that happening on the federal level to the specific degree that I think would benefit business owners and people who have office space and people whose livelihood depends on downtown Seattle being vibrant. So there's got to be some way to kind of cut through the messaging, or create a messaging that's clear and that undoes so much of the confusion of just like you described, Dr. Gupta, and create that certainty. I mean, it's one thing to come to a stadium, you know, and for a 3-hour game and outdoors with a mask, you know, sitting, but it's another thing to come every day to the office and know that it's safe, know the transportation is safe. And that there's several questions I want to get to this and kind of aggregate this together. This notion of before COVID, there were safety issues in downtown Seattle, a lot of perceptions about lack of safety in certain parts of the city, whether it's around transit, around certain parts of downtown. How has that changed during the pandemic? And how do we reassure people that those issues are also still being addressed, where they've been sort of the distant second in terms of focus on health and safety of the last 14 months? And that can be, Alice, do you have any thoughts about that? I mean, you've been focused on transportation and everything. You were working on this before the pandemic, so you know what I'm talking about.
Yeah, I do. I'm also an employer. My office is downtown. I'm at 3rd and Pine. And part of my mental health routine is that I go into the office once or twice a week, because I love my office and I love downtown. And I have been living and working in downtown Seattle for a while, a long time. And that is, there are elements of everything about my life before that I just drastically miss. I know we all do. But it would be incorrect to say that downtown looks and feels the way that it did before, right? The issues that are facing our downtown are serious ones. And especially around homelessness, and especially around, you know, extreme economic inequality and drug addiction and mental health issues and all of those things. But what I can tell you is that people, you know, really care about those issues, and things are, people are pulling together to try to solve them. I don't work in the issue of housing or homelessness or mental health or addiction, but I can tell you that transit is safe, that transit is necessary, and that downtown has something to offer that nowhere else has. The lunch options at downtown are certainly better than they are here in my living room. And there's a lot more people to talk with. And I just, what I've seen over this whole year is a strong desire. People are willing to put a lot on the line in order to be together. And I think that will continue to be able to drive us to see a better future for the city that we all love, are invested in, and really need in order to feel like we're whole.
Kris, do non-COVID safety issues come up with your clients?
Yes, absolutely. And I don't think I have a comment on what's being done to counteract these issues, but I would say that in some of this messaging, it's on us as employees or employers to come back and kind of reclaim the city and make it vibrant and safe again, by filling out the streets and supporting the retailers and bringing life back to the city. That's the solution. Leaving it vacant and boarded up and kind of have a little bit more of a wasteland, like that's not the solution. Having that go on for 6 more months is not going to help the problem. But if we're all down there and interacting, living, working, playing, that's going to help the city, regardless of what public solutions are in play.
Yeah, my hope is that in a time of COVID, there's been on a local level a real focus on solutions, on sort of like imminent problems that need to be addressed right now. And it seems like with the social unrest of the past year, with the forced groups and jurisdictions forced to work together to address problems rapidly, maybe the silver lining in all of this is a new approach to what have seemed like intractable issues. And as always, as you said, Kris, activating spaces, which DSA has done so well in so many parts of the city for many years. The more we activate the city, the more we activate all of downtown, those problems tend to, shrink in size and shrink in their impact, certainly. So, I mean, hopefully there are silver lines. That's the one thing. I don't think the long-term effects of COVID negatively or positively. And I like to think, looking back into history and all the rough times in the past, there are good things that have emerged. A shared sense of facing something together, a shared sense of what are the solutions to these problems that we need to address right now, that then gives us confidence to address things that had been thought of as intractable in the past. So I'm very optimistic. I mean, I love downtown Seattle. I started working in downtown Seattle in 1984, and it was very similar back then, but it's just always been a great place and a great sort of magnet for culture and activity and economic activity, and just a place where people want to be. And I know that we'll be back to the downtown Seattle that we know and love in the not too distant future. So, I want to thank our panelists today. I want to thank Dr. Vin Gupta. I want to thank Kris Curtis and Alex Hudson. It's a great conversation. It will be available online. I want to thank Amazon for supporting this virtual access series with DSA. We will be getting together on Thursday, May 20th for our next installment. You'll get details in your inbox, but we'll be talking to leaders from cities around the country about challenges they're facing and solutions they're coming up with to take the most advantage of this next phase of COVID recovery. We are all in this together. We are Seattle strong. We've overcome things before, and we'll overcome this. And I appreciate all of you for joining us today. Thank Amazon for their support for the series, and thank DSA for putting together Downtown Virtual Access. And thank you all for taking part.